Hi, my name's Kim Tait, Occupational Therapist working with Dr. Hong, Plastic Surgeon. I'm going to talk to you today about post-op Dupuytren's contracture surgery instructions. The first thing being that if you have Dupuytren's disease, then you've had a condition where the fat in your hand or the fascia contracts. You develop these cords and hardened, puckered areas in your hand. And if it gets to the point where you can't fully straighten your fingers, then often surgery is recommended. And that's where, if Dr. Hong has deemed you a surgical candidate, then you will require a pre-op splint that you'll need to take to the surgery. Those splints are custom made, often by an occupational therapist like myself, into full extension. After the surgery, you would need to wear this splint continuously until the sutures come out, which is about 2 weeks after surgery. You will perform wound care, just regular washing with soap and water, remove your surgical dressings, a little bit of polysporin. When you're home, just let the air at it. If you're out, you cover it. You're gonna wear the splint, as I said, continuously till the sutures come out. You can take it off for hygiene, shower, and some gentle exercises. So you would do 3 fisted positions. Flat point, up. Curling, making a fist, moving your thumb, and moving your wrist. No squeezing balls, no pushing on your joints. The sutures will come out after 2 weeks, and you'll start to come out of the splint more frequently during the day and use your hand normally through activities of daily living. Once that wound is healed, you're going to start to do very firm massage all around the incision and over it. You want to push and do circular motions. You don't want that to get too thick. Most people do require several sessions of hand therapy post-op for scar management, swelling control, range of motion exercises.